So welcome guys, and thanks for joining me once again on Tap, otherwise known as the Alphabet Podcast. So those of you that have been listening for a few weeks now, you'll be well aware of the concept, but each week we take a letter and we look at a mental health issue that corresponds with that letter, and the aim is to make you guys your own therapist. So today we're going to look at COVID. Now, when I came up with this concept of the alphabet, COVID was one of the kind of things that was first and foremost in my mind. Personally, for me, I trained as a therapist during COVID, and it was quite a transformative time for me. But also recognizing that for a lot of people, it changed their lives forever. So just looking in general from the good things that I took away from COVID, it was a lot of gratitude and just feeling grateful for a lot of things. And just on the negative side, the bad things, a lot of people died. A lot of people are still ill, and many people never had certain closures through the losses that they went through. I looked at some figures, like I do with all my podcasts, and straight away, I looked at the fact that the COVID pandemic triggered a 25% increase in both anxiety and depression worldwide. And you can understand why. We were all at home. We couldn't go out. We couldn't connect with our loved ones. We couldn't go to work. For most of us, the TV was probably the saving grace. I think I watched every single episode of every single series I ever wanted to watch. I mean, I won't name the platform because they're not paying me, but I like to look at both sides of things when I'm presenting something. And to be honest, the pandemic for a lot of people was bad, but for some people it was good. So to start off today, I thought I'd look at some of the things that were positive about the pandemic. So I've just got a list of things, and I'm just going to go through the list. So just understand that everything is not on the list, but these are just the kind of general things that kind of came up. So time off work, that was great. For many people, the time off work, absolutely wonderful. The term furlough, my favorite term ever. Yeah. So, for a lot of people, time off work. For a lot of people working from home, if they didn't have that time off. So they were able to work from home. And for a lot of people, that was positive. Okay. So a lot of people started businesses in the UK, actually. COVID was a very productive time to start up businesses. UK startups were up 22% during COVID. So, for a lot of people, it was a good time. When I spoke to a lot of my friends, one that came up quite a lot was time to reflect. And a lot of people couldn't think of anything negative about the pandemic. It was, really, I had all of this time to reflect and, look at all aspects of my life, my relationships, my career, what makes me happy, am I being myself? And a lot of people did take that time to reflect. What also came up, time with children. Although I will suggest, depending on the temperament of your child or children, that would probably differ depending parent to parent. But, that time with your household. So potentially if you live at home with your partner or your husband or your wife, that time with other members of your household, your siblings, your grandparents, whoever's in your household. And for a lot of people, COVID was quite positive in that they strengthened those relationships, and those relationships went from strength to strength. A lot of people developed some healthy coping strategies. So they were using their time allowed outside to exercise, to practice mindfulness, to meditate. I know for me, I didn't do much of that, but my house was like an episode of MasterChef. Like I was cooking like there was no tomorrow, things that I wouldn't normally do. But I was filling my time with positive things, reading, like I say, watching a lot of TV shows that I wanted to catch up on. And that was largely positive. I think another thing that came up was the way people maintained contact. People got more creative. I heard stories of elderly people learning how to use FaceTime and Skype, and people finding different ways to keep in touch and keep those links to stop that loneliness and that disconnectedness from creeping in. What else came up? There was loads of time for like home projects. The DIYs, people were painting, putting up shelves, things that they've put off for a long time. And a lot of people highlighted that, it was largely positive. But with everything that's positive for one person, it's going to be a flip side for someone else. So I'm just going to quickly go back through the list, but I might spend a bit more time just explaining the not so good side of COVID for some people. So straight off, we mentioned the time off work, for example. So that was good, positive for a lot of people, but some people didn't have any time off. So we're well aware of the emergency workers, the bus drivers who at the beginning of the pandemic were dying, and that was terrible. All the NHS workers that lost their lives and were going into the front line, not really knowing what they were dealing with. But, to a lesser degree, the supermarket workers that kept the supermarkets open with not much regard for their own safety. Then you go back to the working from home. So, if your house is set up to work from home and your kids are of a certain age, that could be positive, but it could also be negative if you don't really have a quiet space, or you're someone that, tends to overwork, or you have issues with your neighbours, or work for you was the only time you interacted socially with people. So then suddenly being forced to work from home would not be so positive for you. So I mentioned that a lot of people started businesses during COVID, but a lot of people lost businesses. A lot of people lost their income. And for a lot of it, people that were self-employed, the government wasn't really helping them. So that was quite traumatic. And some people lost their homes. And there's always knock-on effects. So homes, relationships, everything, children, everything that comes with that. So I mentioned my friends found it largely positive that they had time to reflect. And, that was positive for me also. I had time to reflect and look at aspects of my life I wanted to change. But equally, look at those that may potentially already had mental health conditions. That time to ruminate and to struggle and have those negative thoughts maybe going through their mind. That lack of social support for them, that social network, the closure of services. A lot of services closed down with the lockdown. So the support services that were available for these people were suddenly not available, and they had all of this time, which for some was positive, but now they've got this time to just be alone. So I mentioned time with children, and this is a big one. A lot of parents struggled to homeschool their children while also trying to navigate working from home. They're parents and not teachers, and I think a lot of parents have a greater appreciation for teachers now, because it's not easy. Children have different ways of learning, different learning styles, but, also the knock-on effects for children's education. Because I know, for example, my niece was doing her GCSEs at the time when COVID hit, and there was a lot of anxiety around kids doing their GCSEs, and that had a negative effect on their mental health. So that was bad. And we already know that children who live in poverty are 4 times more likely to suffer from a mental health problem. So suddenly you've got kids at home and parents can't afford to feed them. So how's that affecting not only their physical health, but their mental health as well? So if they're 4 times more likely, add COVID, I would suggest they're more likely to have issues with their mental health. There was some stats compiled in the autumn of 2020, and there was a 68% rise in suicidal thoughts of secondary school children. And that was done by Place to Be. So you can see that there's a flip side. So I mentioned time with the household and how it strengthened some relationships. I mean, on the plus side, some people were forced to stay in situations and relationships that were detrimental to their mental health and physical health. The National Domestic Abuse Helpline reported a 65% increase in calls in the first 3 months of the pandemic compared to the previous 3 months. So that's a 65% increase. And what I found interesting, I think most people understand domestic violence usually to be between an ex-partner or partners, but there was a rise in family violence. So suddenly children attacking parents, siblings, all of the dynamics of family, suddenly there was a rise in all of that. So you have to look at that. So if your household was a happy place and the relationships were strong, it was positive. But if it wasn't, being stuck at home for basically a 2-year period was very problematic for a lot of people. and would have impacted negatively on their mental health. So we've mentioned the healthy coping strategies. So, I mentioned I did the cooking, some people exercised. But what about the unhealthy coping strategies that came up as a result of COVID? And I'm not talking about the overeating. I think we all kind of spent a lot of time going to and fro from the fridge. And I think that's to be expected. You stay at home, you may put on weight. Your eating habits may change due to boredom. That's fine. But what was more interesting is that 48% of adults that were interviewed about it said that their alcohol intake had gone up. 44% of adults that were interviewed for this survey in particular said their cannabis intake had gone up. 28% said their prescription opioid use had gone up. Interestingly, though, cocaine use was down 52%. So maybe the situations, such as the work, the club environments, so other drugs like MDMA and ketamine were also less used. So there's something about the setting. But the at-home drugs, the marijuanas and the alcohol, people were drinking and smoking more to cope with the boredom. So I mentioned maintaining contact virtually with loved ones, but that wasn't possible for a lot of people. And a lot of people disconnected into a virtual world. So that's the idea of social media. Elderly people who couldn't use technology struggled a lot during lockdown. But just going back for a minute to this virtual social media world, I think it was Ed Sheeran that I heard describing a situation where when people posted selfies, he really wanted to just reach through the screen and give these people a hug, because it's that idea of posting selfies, for that external validation for something that we're lacking inside, the looking at the cult of celebrity and looking at their lifestyles and forgetting at some stage that this is what people are choosing to capture. What you see on social media is like a snapshot of a moment. It doesn't show what goes on behind the scenes, whether these people are truly happy. It's just a perception. And if you buy into that, how dangerous that can be. And interestingly, during the first wave, 70% of people asked said that their social media use had went up. And I think we already know how problematic social media is with children in terms of online bullying and so forth. But adults, the subconscious works in a similar way. Just be careful what you feed it. So I know I mentioned that people had loads of time for home projects. So, I didn't do much other than decorate a few bits here and there. That's not really my forte. But, think about the people that are at home and they can't escape and their job is at home. So like the carers, me personally, as well as being a therapist, I'm also a carer. And I think the only downside of the pandemic for me was just not sometimes being able to just go and do the things that I would normally do to de-stress, so go and relax with other family members to just take myself out of that situation. And then there was the added complication that, the adult that I care for had a very limited understanding cognitively about the pandemic. So it was constantly trying to ensure his safety while trying to explain to him what was happening. But interestingly, 40% of young carers said that their mental health got worse during COVID. So that's 40% of young carers and 59% of adult carers that have said their mental health has got worse since COVID. And the figures are slightly higher for both categories when asked about their worries for the future. So there's definitely something in it about how we look after our carers, because there was a lot of clapping for the NHS, but I think carers were largely forgotten during that process. So imagine being stuck at home. A lot of the support services were closed, the day centres, all of the respite care, and it was a very difficult time. So I'm hoping that I'm illustrating that what was good for one person is not necessarily good for another person. And just to show you that for a lot of people, lockdown was good. They got a lot of positive from it. And like I said, the most positive thing that I took from it was the gratitude. But it's also important to remember that even though it seems surreal, a lot of people died. A lot of people are still suffering from long COVID. A lot of people lost family members and loved ones and couldn't go to their funerals. And how does that impact on the process of grief? Because you have 5 stages of grief: the anger, the denial, I'm not saying it in order here, but the anger, the denial, the bargaining, the depression, the acceptance. How does not being able to say, go to a funeral or say goodbye to a dying loved one impact on you going through those 5 stages and getting to the final stage of acceptance? So complicated grief is something that I'm going to try and introduce to the podcast. I've done a whole podcast on complicated grief, I should say, but looking at the context of death. But complicated grief and grief in general is not just death. It involves a lot of layers of loss, and loss of self, loss of relationships, loss of people. It's a lot of things. So I'm going to pause there for a moment, and when I come back on the other side, we're going to take a look at the impact of Covid-19. So I'm not going to look at everything, but I'm going to pick out a few things, look at a few trends, things that really stuck out for me and that I want to highlight today, but not just talk about it and present it, but try to provide a couple of solutions. So I'll be back on the other side. Now, so far on the podcast, we've had a look at some of the good and bad things about COVID and how some good things in terms of mental health and some bad things in terms of mental health. But now I just want to pull out a few things that kind of stuck with me. So I'm not going to cover everything because we don't have that kind of time. But I think what the lasting impact of COVID-19 for me that I noticed with a lot of people is that there was more awareness around mental health in general. I think before that, people tend to have this image of mental health being simply just mental illness and often being misinformed about what that looks like in reality anyway. So a lot of misinformation, a lot of stigma, which to a certain degree still exists. Otherwise, there would be no need for a podcast like this. But I think a general awareness that, of people being more aware of mental health. And the first thing that I want to point out, and I will keep referencing it, is that mental health does not mean mental illness. Mental health is something that we all have, the same way we all have physical health, and it's on a continuum. Some people have better physical health than others. Okay, so there are times in all of our lives where we suffer from poor mental health, and that could simply be because we're not sleeping, or we're too stressed, or we have a relationship breakdown, or we have issues at work. But it's not the same as mental illness. But inevitably, if we don't look after our mental health and we suffer from poor mental health for long periods of time, it will go on to have more and more impact on our daily life and stray into becoming a mental illness. So people, I think, are more aware that you have to actively promote your mental health the same way you would your physical health. You go to the gym, so why wouldn't you go to therapy or to a support group or talk to your friends, seek help? So that was one of the main things that came out of it for me. And I think the more awareness that people can gain, because there's so much information out there, if you think that you may be struggling with something, it's not to sit in the dark. We're quick to use our phones to Google things, and sometimes we Google some of the most basic symptoms and convince ourselves that we were going to die tomorrow. But actually, we could make use of that more and research better. So go to trusted sources, charities, support groups, and find the right information to look after our own mental health. And if those around us are struggling with something that we don't understand, just finding those sources of support, most simply online. Another big thing that came out, and I think is a lasting impact of COVID-19, is the way we work. Because I think a lot of the change has happened is to the way we work. The way we live, definitely, but the way we work. So we have so much more working from home and hybrid working. And to some degree, that's good. You have more flexibility. There's less traveling. You've got a better work-life balance. Like I tried to illustrate with the previous section, there's flip sides of everything, and there's different types of people. So if you're someone that is able to switch off quite easily, working from home will be good. If you have older children or maybe no children, it will be more suitable. But if you're trying to navigate parental things and you have all sorts of things going on at home, it can not be so good. If you don't have good boundaries, for example, you may find that you're overworking. So people with good boundaries tend to be able to switch off, keep that balance. Some people not so much. So the not switching off, I think a lot of people tend to work from home and don't give much consideration to their workspace. So they may work from their bedroom or their living room. Maybe that's the only space they have available. But I would suggest wherever you spend the most time, do your work from home in the other room, because it can impact then how you sleep and how you switch off. I used to do a lot of my client work in an area that I'd set up in my bedroom, but now I have an office set up in the front room. If I had more space, that would become an office, because it's important that you have those distinctions. And if you don't have much space, I think it's very difficult sometimes when you've had a stressful day at work. Normally, when you're in the office, you have that time when you walk home, when you can switch off and come back down and process your feelings and then enter your family home with a better attitude. But if you have a bad day, and I was finding myself, sometimes I'll be having a session with a client and I'll literally be stepping out of one room and walking straight into family life. And where's that space in between to process things? So if you don't have a lot of space and you have a very busy household, it could be beneficial for you to go for a walk. So as soon as you log off, go for a 10-15 minute walk, maybe just to the local shops. But you have that time that kind of imitates that traveling time, that kind of gives you time to switch off and get back into your new role and put on that different hat. Maintaining social connections is very important. Some people like the office because of the company, and working from home, actually, when you don't have any social connections, is very lonely. So how do you connect with people if you're stuck at home for working and then you're at home anyway? So it's just being mindful that different things mean different things for different people. So maintaining those social connections, even sometimes when you're tired, just making that effort to connect with people socially. Because a lot of what people missed during COVID was that physical connection. Being able to give someone a hug, how important was that? We suddenly realized the importance of physical touch and physical connection. You know, we're human beings and that's what we kind of desire. So working from home, just take those things into consideration. But another positive, I find that more people are seeking help and accessing the services. And I think it's good that people are seeking help, because people are now more aware of how mental health works and the support that is out there. So I think it's good that people are actively promoting good mental health. But the negative of that is a lot more people have reached out for help. And that has a knock-on effect on the services that are often oversubscribed. So we can invest in therapy, which a lot of people are often reluctant to do. They will invest in things to do with their physical health, but somehow an investment in therapy seems like a step too far. But one of the main things that we can do, and I hope the pandemic has taught us this, is look at how we manage our own stress. And as well as being a therapist, I'm also a mental health first aider. And I advise anyone who has an interest in learning more about mental health to maybe subscribe to that course. So that's Mental Health First Aid England. You can go on their website and they do a range of courses. I mean, I've done a suicide awareness course with them, which was only a few hours, and it can teach you how to save a life, potentially. So, you know, as well as being a therapist, I'm a mental health first aider, and we look at these things. And one of the things that we did during training was looking at our own stress containers. So it's sometimes good to give people a visual, because when you tell people, sometimes they can't visualize something, it doesn't really kind of process. So we've got to look at these containers. So during training, we were sent away to go and physically pick up a container. So me being Jamaican Irish, I went to the kitchen and picked up a food container. It was a small one because I'm not going to my mum's to collect food. So it was a small container. But then the idea was to put something in that container, and then maybe to put something else in that container. So you can maybe illustrate this with cocktail sticks or pens, and each stressor that you have, whether it be from your home life, your work life, or your outside life, things like your health, your relationships, all of these different stresses, your chores, your deadlines, all of the things that you've got to do that stress you out, that cause you stress. And you want to look at that. And the next thing you want to take into account, depending on your background and the things that you've been through, you know, your childhood, that container that you're putting this stress into will be smaller. So people that have had more stable, secure attachments, good upbringings, their container will be a lot bigger. So their capacity to deal with stress a lot bigger. So these containers will be quite small. But what we need to look at is the things that we can do to manage our own stress containers. So when we're thinking about our stress containers, we want to take a look. So you might want to physically do it. Look at the things that you can change. So that the things that you can change about your stress containers tend to be the things that are outside of your control. A lot of things like anxiety are caused when you worry about things that are outside of your control, you know? So take some of those things that you can't control out. Have a look at what needs your attention the most. So prioritize. Am I stressing about something that's 6 months in the future when I've got something to do tomorrow? So maybe I can take that future thing and take it out of my stress container. It can go back in later when my container's a little bit less full. Then we need to start looking at who can help me with this stress container, who can take some of this stress out away from me. So who can help me? So that's like your support system, your friends. If you're really struggling, support groups. You know, what helpful coping strategies do you have? And they teach you all of this on the mental health first aider course, but it's also a model, the stress container model. You can look it up online. What helpful coping strategies do I use? Do I exercise? Do I make sure I'm sleeping right? Do I do breathing exercises to make sure that, you know, my stress is managed? Do I read? Do I go out? Do I practice self-care? All of these things. Do I see family and friends? Is my work-life balance okay? Am I doing things that I really, really enjoy? And then it's a case of maybe looking at your unhelpful coping strategies. So those could be the drugs, the alcohol, all of the things that you do that are not necessarily the best way to deal with things. Some of the reckless behaviors, some of the anger, whatever it is that you do that is unhelpful. And any way that you can manage that stress. So for me, I think exercise is a big one that a lot of people can do. Talking about your feelings and having people around you that you can trust helps you to manage your stress containers. Really focusing on prioritizing. So you're not overthinking, exercising boundaries. Okay, so you know when to say no to people. Actually, my container's full. I can't do anything more. I can't allow you to put something else into my container. And I think boundaries are so important, and it's something that we'll keep revisiting. But boundaries are a good way of making sure that you manage your stress container. It's a very good way. What other things? Children's mental health was a big thing that came out of the pandemic for me. A lot of children really struggled, not just the young carers that I mentioned, but children in general. Because, you know, children, they're quite innocent, and the pandemic would have been the first time that they would have to have learned so much about fear and not being able to play with their friends and do all the things that they enjoyed, like wanting to go and do things and being told you can't do this, not being able to celebrate birthdays. But there are some good things that came out of it, because now this is being recognised. People are gaining a better understanding about children's mental health and how it may present differently, because children don't necessarily have the words as adults do. A good little strategy that parents can use is a feelings wheel. You can buy them on Amazon for a few pounds, and it's just got like a range of feelings. And so you might have anger or something as the main thing, and then it takes it down. And then it might be like fear or hurt, and it just helps you to get children to name their feelings and verbalize what's going on for them. Because children often do present differently, so they might be acting out in their behavior. But you have to look at things like changes in your child. Is your child sleeping? Is your child eating? You know, what are their friendships like? Question them on things like this and keep questioning. Because the more you do it, the more they'll realize that you mean what you say and you do want to listen to them. So it's very important. If your child is really, really struggling, it's important to know that things like CAMS, Children and Adolescent Mental Health Service, are there. But the issue with that is, depending on where you live, CAMS has a very long waiting list. I think in South London, where I am, it's nearly 2 years long. So what can we do about that? Well, one thing we can do is involve the schools. We can involve the schools in the process. When we make self-referrals, that the threshold is a lot higher and the waiting list is longer. But if you feel confident enough and you have a good relationship with the school, just simply liaising with them and getting the school to make the referral will help the process, because the threshold is lower, I believe. Correct me on that, anybody, I don't mind. But it can actually push your child up the queue. And ideally, any kind of issues that your child is having with their mental health, you do want to get the school involved, because it has to be a collaborative approach between parent, child and school to ensure that your child is getting the best help possible, because the waiting lists are very long. Another thing that came out of COVID, obviously, and we cannot not mention this, is long COVID. And we already know that people that suffer from chronic illness are more likely to suffer from things like depression. From my own experiences of having an autoimmune illness, more than the physical symptoms, I know for me, a lot of it was the mental, just feeling withdrawn and not being able to be around people. So not feeling your best physical self can have knock-on effects on your mental health, and not being able to exercise as you could before because now you're having breathing difficulties. It could be something as simple as not being able to smell and that affecting your day-to-day life. But it's important to note there are support groups. There's a charity called Long COVID that supports individuals and families with all aspects of dealing with long COVID. And some people might find that useful because people often forget that your physical health and your mental health are very connected. So one or the other, but they affect each other. So they're interrelated, they're interlinked, however you want to describe it. But yeah. So now, for the first time, I want to introduce this term of complicated grief. I've done a whole podcast on complicated grief and how it relates to loss. And in the case of that particular podcast, how a friend of mine dealt with the complicated grief around having her son murdered and how she kind of found her joy again and went through those 5 stages. So when you look at death, it's a lot easier to notice the 5 stages of grief. So you have the denial at first. You have that denial phase where you're like, this can't be happening, it's not happening. And then you have the anger, like, why is this happening to me? Then you have the bargaining, especially with grief through death. Like, I'll give anything just to have that person back. Then you get the depression where there's just the numbness and you just tend not to feel anything. And then there's the acceptance. Now, it's important to note that some people, when they're grieving, don't go through all those stages. And some people miss stages out, and you can revisit stages with grief. But with complicated grief, from a medical perspective, it's grief that's lasted for longer than 6 months. And it does look a lot like depression. It's something that I will mention on the other podcast. The thing with complicated grief is not just death. So I think a lot of people are feeling very sad and struggling with a lot of aspects of COVID without really understanding why. So if we go back to the 5 stages, and I mentioned at the first stage, it's the denial. I think at the beginning of COVID, we were all in denial. This is not happening. The government is not literally telling us to stay in our yard. This cannot be happening. Then there was the anger. Like, what do you mean we have to stay out? And then there was the bargaining, especially I can relate this to myself because bargaining is a very individual thing. So you may not always be aware of what other people are bargaining with. But I know one particular bargaining that I had was when it came close to a significant birthday of mine. I won't say which one. And the rules were okay. You could have up to 30 people. And I'd made these plans and then the law changed. So it was like a couple of days before my birthday, it'd gone back to being 6 people or whatever. So I remember in that time bargaining, saying I'll give anything just for them to change the law so that I can have all my people around me. But obviously I found a way around it because you can always find a legal way around the law, people. So there was that. But then the depression. And I think a lot of people went through stages of COVID where they felt depressed after they'd watched everything on the channels. I'm not going to mention them because none of them are paying me. When they finished watching all the TV programs that they could go through, especially towards the end, there came like periods of depression before finally accepting that this is the new norm. But what if you're not accepting those stages and you've gone through and you're constantly going through and having to navigate it? Because I would say for a lot of people, they're still in kind of denial that it's even happened. We went through something quite traumatic and something that no matter how rich, you were all going through a similar type of experience, being separated from your loved ones and just stuck at home. I see a lot of anger in people, but I don't know if they recognize it in themselves, but I see a lot of anger about COVID. I see a lot of anger. Like I say, the bargaining is a little bit more personal, but I definitely see a lot of depression and the stats back it up. There's a lot of depression, a lot of general apathy, a lot of environmental grief. People are suddenly more sensitive to everything that's going on around them. Right? And I say not a lot of acceptance. For some people, they haven't accepted that their lives have changed forever. The way we do things has changed. We're moving towards this cashless society where we're tapping everywhere. Things have changed. And while some people have moved with it, some people are struggling with that acceptance. So that's the complicated grief. It's a period of grief that lasts for longer than 6 months. And I think for a lot of people that experience COVID, whether they experience the physical effects, COVID will go on for a long period, to come. So just before I summarize, I hope you found some things on the podcast useful. So I'm just going to pause for a moment and just give us all time to reflect and take that in. And then I'm just going to summarize the things that we can do to help ourselves. So guys, what can we do to help ourselves and improve our mental health post-pandemic? Well, I mentioned just a little while ago about looking at and managing our own stress containers. And that's very, very important, because with most mental illnesses and poor mental health, stress will be a significant factor. So if we can just simply manage our stress, that is very important. Self-care is also important. And if we're implementing good self-care, we're probably implementing boundaries and probably managing our stress containers more effectively also. I think a big one, and I've touched on it, but limiting social media use. And if we do use social media, using it from a positive aspect, so looking at things that inspire us. So maybe not looking at what we see as other people's perfect lives and then feeling the need to compare, because it can be very negative in terms of what people consume and the knock-on effects on their self-esteem, especially having coming out of a period like COVID, which was quite negative. Looking at other things that people are portraying, because it's just a perception, is not always helpful. And it's actually more helpful to build, to seek, and to utilize the support systems that you have available around you. So that could mean your friends and family, your hobbies. You tend to find that if you struggle to connect with people, simply getting out a bit more and indulging in your hobbies, you'll very quickly gravitate towards like-minded people. And it's very easy to make those connections if you're confident enough to get out there. And if you're not confident enough to get out there, it's about doing the work around becoming more confident. So maybe talking to a therapist, but as well as the support systems around us, but there's also good online resources, charities, etc. If you're struggling with your mental illness and you're having suicidal thoughts, you have things like the Samaritans, you have organizations like Shout, you have organizations like Crisis 24/7 text line that you can reach out to. So there's always trusted sources of support, and a lot of them are available 24 hours a day. I think it's very important, and this is a big one, and it's one that people don't necessarily think, because they tend to see what other people are doing and feel like they have to be where other people are. So it's important that you go at your own pace. It's important to get back to the things that you used to enjoy, but it's also important that you indulge in some of the new things that you enjoy post-pandemic, because you might find that your hobbies have changed. But whatever it is, if it involves going out and it makes you feel anxious, it's just about not being forced to. Go at your own pace, but recognize where you struggle. So if you're not going out at all post-pandemic, you have to look at that, because it could be that you develop, or, your social anxiety that you had previously has gotten worse, and it's something that you need to address. Talk to people that you trust about your fears. So you don't necessarily have to talk to a therapist, although there are a range of therapists from different backgrounds that you can talk to. Not all therapy is, long for years and years. Sometimes as little as 6 sessions can help you. If you're struggling with something like COVID and the long-term effects of COVID, or the complicated grief of COVID. But a big one that people often forget to do, just like they forget to do their breathing exercises every day to help with panic attacks and anxiety and stress, is practice gratitude. I said at the beginning that it was one of the best things that I took away from the whole pandemic experience, I should say. And that was to be grateful. And I think when you're feeling quite negative, it is really hard to be grateful for anything. But if you're struggling to see the good things in your life, simply just writing down 2 things that you're grateful for, or 2 things that, went well today, or a combination of both, just before you go to bed, and see if that doesn't help to shift your perception. Because it's only sometimes when we write these things down that we see the beauty of what's around us and all the things that we have to be grateful for. And I think that's what we need going forward if we're to recover, is that sense of gratitude. But remember, you're not alone. A lot of people have struggled since COVID. On the surface of things, they may seem okay, but you never know. And you never really know what people are dealing with inside. So always remember, if you're having harmful thoughts or suicidal thoughts, seek help if necessary. Even if you're not having these suicidal thoughts, but you're just really struggling, seek help if necessary. because the right help is out there. So I hope this podcast on COVID has got people thinking. There's so much and so many things I could have added, but we could have literally been here all week because COVID affected people in different ways. But I think it's really important that we have that self-compassion and understand that something like COVID, being essentially locked in your house for 2 years, is something that's not likely to happen again, certainly not in our lifetime. So remember that we went through a unique experience and that we need time. So hopefully that's helped. And next up on the podcast will be depression. So I hope you've gained something from today's podcast. And wherever you're listening, I hope you have a great day.